Okay, I just received a chart and a medication administration record for a patient who is just admitted for rehabilitation due to a CVA. She is 72 years old, and it's thought that she had a thrombotic stroke related to some atrial fibrillation that she's been having. So she does have some right-sided weakness, and she is wheelchair bound. She does have a gag reflex, but swallowing is a little bit difficult, so we want to make sure that her fluids have that thickened nectar added to it. She is a type 2 diabetic, so it's important to note that. She's been complaining of nausea and refused breakfast this morning. So I did go ahead and already compare the chart with the MAR to make sure that those match. I went ahead and already looked up all the medications and made sure I see that she had a sulfa allergy. So one, I wanted to make sure that nothing was contraindicating with itself as prescribed, and then two, that there was nothing within those prescribed medications that would somehow have some sort of sulfa or any component to cause a reaction. So going off of the orders and the very recent vitals that were just taken, I was tasked with giving the 8 a.m. medications. So looking at the vitals and the labs, a couple things that are really important to note is that she has an extremely high blood pressure. It's 168/88, and we're going to go ahead and address that with some medications, and I'll kind of go into that a little bit. The other lab results, everything is pretty good except her glucose. Her glucose is really high. It is 258, which is concerning because she hadn't even had breakfast. But because of everything going on with the recent stroke, it is really common for people to have stress or have, just issues with, health. While in the facility, your blood and glucose can fluctuate. So we want to make sure that we get that under control. Hyperglycemia is really dangerous, especially when you already have heart problems, but you can create even more issues with having, long-term elevated hyperglycemia, just because glucose is basically a crystal. So it can create like minor or minute like little lacerations within vesicles and like the vasculature, capillaries, and even the tissues within your eye, creating a retinopathy, as well as your kidneys. So moving forward, as I mentioned before, she had a CVA. She does have a type 2 diabetes, and she does have a sulfa allergy, and she does have coronary artery disease. So we've got a lot of issues going on, and she's been type 2 diabetic since the age of 65. So a couple of the things that just kind of stand out is she's had diabetes for about 7 years now. So I want to make sure, if I were to continue taking care of the patient, make sure that she has education, understand the reasonings of why glucose control is so important, because just charging, she's probably going to still have a lot more medications and a lot more symptoms to manage, and a lot more things to look out for that could potentially alter her glucose levels. All right, so now we're going to go ahead and we're going to go into the actual Pyxis room and pull medications, because now we had already verified that there were no discrepancies between the chart and the MAR. Okay. So one of the first medications that we need to go ahead and grab, it's an antiarrhythmic. It's amiodarone, and it's 200 milligrams. So I'm going to go ahead and grab that. It's not expired. This is actually going to treat the heart flutter, the AFib that she's having. What this does is it lengthens the refractory period for the heart, so it kind of gives the heart a little bit of a break. It's not so much into a flutter because it actually does inhibit a lot of adrenic stimuli to the sinus node. So what that does is it kind of disrupts the the irregular electrical impulses to kind of give it a pause for just a quick moment so that it can become a little bit more regular and stable. Okay, so this is going to be assisting with that in order to manage the atrial fibrillation. And then in combination with the next medication that I'm going to pull from the Pyxis, which is lisinopril. And so it's lisinopril 20 milligrams. Lisinopril 20 milligrams, not expired. This is a common ACE inhibitor. What this does is this is actually going to prevent the conversion of angiotensin 1 to angiotensin 2. This is actually the ACE converting enzyme from 1 to 2. If it becomes angiotensin 2, and if it does convert, it is basically a hormone that stimulates vasoconstriction. So it basically decreases and constricts the vasculature, which we wouldn't want because she already has high blood pressure. So what this is going to do is it's going to inhibit that conversion, ACE inhibitor, so that instead of creating vasoconstriction, we actually have vascular dilation, which is going to help drop the blood pressure. Our blood pressure right now is 168/88. What that basically says is the diastolic is the pressure when her heart is contracting, which is really high, and then it's still really high, or it's still high when it's at rest, which is the diastolic. So we want to get that lowered so the heart isn't working so hard, the pressure, because that can create major issues. And that's going to be a medication that we'd want to educate the patient on, making sure that even if she does have good blood pressure levels, it's a maintenance drug. So just because she does have a lower blood pressure or within the range that we prefer, doesn't mean that she gets to stop the medication. She needs to take it as prescribed by her provider. Next medication is warfarin, also known as Coumadin. So we pulled this from our Pyxis. Warfarin 5 milligrams. Warfarin 5 milligrams, not expired. Warfarin's an anticoagulant. So since she does have the atrial fib, until that becomes stabilized and until she starts having, really good cardiac output, even with that, she does have the difficulty with mobility. So all those factors can create conditions for someone to develop a clot, and then that would create potentially another CVA or stroke, lots of different things. Especially with the fact that she's type 2 diabetic, this just creates another layer of complications. So we want to go ahead and utilize this for preventative measures. So what this does is this actually will prolong the clotting time. And so what we'd want to go ahead and do is make sure that we have that clotting time within the correct parameters set by the primary care physician. So if we have it too long, then we run the risk of having the patient bleed or have unnecessary bleeding, excessive bleeding, and that is a major issue. So one of the things that I've already looked and checked is that her INR value is within the correct range. That's something that needs to be drawn daily and looked at prior to giving. If it is outside of that range, then you'd want to go ahead and hold the medication and contact the provider. Then we do have our next medication we're pulling from the Pyxis, which is the tupusate sodium, also known as Colace, which I have here on my Mars, 200 milligrams and 200 milligrams. Colace is just it's a laxative, it's a stool softener. So with her immobility or right side of weakness, we want to make sure that she doesn't have any issues with constipation. So with her inability to maybe have muscle contractions or sit the way that she normally would, and just lack of mobility, things are going to slow down. So we'll make sure that she's not becoming constipated. This is just going to keep the moisture within the stool a little bit more so that it's easier to pass. Next thing we're going to go ahead and pull is the Humalog or Lispro. Okay, this is an insulin. It's a rapid acting insulin. So this is going to immediately affect her blood glucose. It's going to drop it. Okay, so I'm gonna just grab this. Looks like it's 100 units per milliliter. Based upon her blood glucose level, we're going to be giving her 6 units. So I'll make sure I'm going to grab an insulin syringe for that. And then we have the Zofran, also known, it's generic. It's Ondastran. And this is a antiemic, or it's like anti-nausea medication. It comes in oral tablets, but for right now we're going to give it to her via an intramuscular injection. And this is going to ask, her MAR requests 4 milligrams IM, and this is 2 milligrams per milliliter. So we need to go ahead and give her 2 milliliters of this medication within a 1 inch to 1.5 inch 23 gauge needle for an intramuscular injection. Okay, so I'm gonna go ahead and grab that. This is the syringe I'll be using. As you can see, it's different than the insulin syringe. The insulin syringes have an orange cap. And the reason for that is just because insulin is usually, it's always measured in units. So I'm gonna go ahead and draw that up right now. Okay, so we're gonna go ahead and draw up 6 units because that fits in within the actual sliding scale that's been provided. So if it's between 251 and 300, we need to go ahead and get 6 units of this. Okay, so what I'm gonna go ahead and do is I'm going to draw up 6 units of air. And then I'm going to go ahead and insert it into the bottle. Push in the air. I'm going to go ahead and invert. Prior to this, I would roll the insulin gently. And that is actually just to assist with like any sort of sediment on the bottom, but you don't want to shake it because you don't want air in there. You need to have the most accurate measurement because this is extremely dangerous if you give too much. So we're going to go ahead and give 6 units. Okay, leaving the actual syringe within the bottle, I'd go ahead and have an actual nurse verify and tell me what she sees. Because one, we want to make sure that we have the correct amount, but we also want to make sure that we have the correct type of insulin. There's different types, different onset, peak, and duration. This one's going to be like less than 15 minutes. It's very rapid acting. So I would go ahead and ask, let me see if I can show this to you. I would ask the nurse, what do you see? And hopefully they would say, I see 6 units of Humalog insulin. Okay. Okay, using the scoop method, never touching the cap, I'd go ahead, put the cap back on. And then, since we are still in here, I'm gonna go ahead and just put a label on here. And what this label is telling what the actual medication is. So it's Humalog 6 units, E-Cleaver, and then I have the DOB here. Today's date, as well as my initials that I drew up this medication. Okay, we're gonna go ahead for the Zofran. As I mentioned, we have a 1 inch 23 gauge needle. And this is for intramuscular injections. We know that we need to have 4 milligrams, so we need to go ahead and draw up 2 milliliters of this solution. Okay, so we're gonna go ahead and draw up 2 milliliters. One thing to note is that IM injections do require a Z-track technique, which is going to help with preventing any sort of damage. If you have a fair amount of fluid going into one location, you want to go ahead and utilize the Z-track method to help disperse that medication in that area. And then per milliliter, you want to go ahead and, when injecting, it's about 10 seconds per milliliter. That way you're not causing any pain, tissue damage as well, by injecting a large amount within a short span of time. Okay, utilizing the scoop technique. Okay. Okay, so we got that on there. And then as you can see, we should have 2 milliliters. I'm gonna go ahead and label that as well. And then we're just going to do our second check, and then we'll go ahead and see the patient and get these 8 a.m. meds administered. So, I've already done my first check. Now it's time for the second check. And let me just point this down here so you can actually see. Okay, so first medication is amiodarone, 200 milligrams, 200 milligrams. I'm gonna go ahead and set that in a cup. Second check for that done. Lisinopril, 20 milligrams. Lisinopril, 20 milligrams. Second check done. And what I'm doing when I'm doing each check is I'm making sure that I have the right drug, the right dose, and also it's almost 8 o'clock, so I know it's the right time. And so that's why I'm making sure. She did mention that she was nauseous this morning, so we're gonna go ahead and that's as needed. So we're gonna go ahead and give it to her because she didn't even have breakfast yet. So for the second check on warfarin, also known as Coumadin, 5 milligrams, 5 milligrams, done. And Colace, or Ducosate sodium, 200 milligrams, 200 milligrams. Wonderful. Okay, so we've got those in our cups. And then let's go ahead and do our second check. We have Lispro or Humalog, 6 units. I see 6 units. Perfect. And for our Zofran or ondansetron, 4 milligrams, 4 milligrams. Perfect. Okay, we should be good to go. We gather, I'm gonna give her the option of either the thickened water or the applesauce. I'll let her decide. Okay, I'm gonna go ahead and bring my MAR. And my medication. And we'll be seeing the patient shortly.
Yes.
Hello.
Hi.
Hi, Ms. Cleaver.
Hello.
My name is Chelsea. I'm your student nurse today.
Mm-hmm.
I'm actually here to give you your 8 a.m. medications. What I want to do first, if you don't mind, can I take a look at your bracelet here?
Sure.
And can you say your name and date of birth, please?
It's Edna Cleaver. Date of birth is 4/18/47.
Okay, and any allergies?
Yes, I'm sulfa.
Okay, I looked at your wristband here and I did
Thank you.
confirm that does match the MAR.
Okay.
Go ahead and actually wash up my hands really quick.
Mm-hmm.
And then I'm gonna go ahead and close the curtain for privacy here.
Okay.
Okay, so I brought with me medications, but I also brought either the nectar thickened fluid or applesauce to take your medication. So you go ahead and think about which one you want first. What we're gonna do is give you your insulin.
Okay.
And this is the rapid acting insulin. It's also known as Lispro. You're gonna get 6 units today because your blood sugar was really high. Okay, and I know you didn't even have breakfast because you
No.
mentioned you were nauseous. Okay,
Yeah.
well, I'm sorry to hear that. Let's see if we can get you some medication to take care of that as well. but I do want to take care of your blood glucose. So this is going to be a subcutaneous injection.
Okay.
Okay. All right, what I would do is I'd go ahead and I'd have some alcohol swabs, and I would start at the center and clean the area and work my way out. Okay, you don't dry it, you just let it air dry. And then for an insulin injection, you'd want to go ahead and let them know that you're going to go ahead and give 6 units. And I saw that the prior injection was on your right side, so we're going to alternate and we're going to go with the left. Okay, it's important to go ahead and make sure that you're alternating sites.
Okay.
Okay, that way you are having the insulin, not just because of the tissue area as well, but so that the absorption occurs in different areas.
Okay.
Okay.
Makes sense.
All right, so we're going to go ahead and just do the OK method. And then we would go ahead and kind of pinch. It's the lower abdomen area. Okay, so you want to pinch, and then utilizing like a dart technique, you'd go ahead at a 90-degree angle, because I do have at least 2 inches of tissue. Insert. Then you put your finger on the plunger, insert. Slowly. Okay. Release. Pull. Okay. I would then go ahead and put the safety on, and then insert this into a sharps container. Okay, so what I want to go ahead and do now is, let's go ahead and give you the Zofran. This is going to be the anti-nausea medication, okay? This is going to help some of that queasiness go away, and I want you to be able to have some breakfast. I did bring you the applesauce, which you're okay to have. I did give you your
I'll
insulin.
go with the drink.
Okay,
With
all
the
right.
Nectar in it.
So what I'm going to do is we're going to do an intramuscular injection with the Zofran. This is going to be fast acting. It's going to take effect within 30 minutes or less. And then what we're going to go ahead and do is we would do an IM most likely into the ventrogluteal area. And I would have her utilize her left side to go ahead and hold on to the railings, and she is right side of weakness. And with the assistance of pillows, go ahead and make sure that she's in a comfortable position for that. And then utilizing the base of my palm, find the head of the trochanter, and then find the correct location. Utilizing the OK method, I would do a Z-track with this particular injection. And what that would be is it would require me to push down on the tissue after cleaning it and then pull it aside. And this will be held to the side until the actual syringe is withdrawn, allowing the actual medication to create a Z within the tissue. This helps with absorption as well as preventing any damage. Okay, so it would be pushing down, holding across, insert, and then doing this slowly because it is 2 milliliters. You want to go about 10 seconds per milliliter. Okay, wonderful. And then I'd go ahead, flick the safety, or just toss into the sharps container. Okay. All right, so I'm gonna go ahead. Are you feeling okay?
Yeah.
All right, so what I would do is I'd mark on the MAR that I gave her the Humalog in the left lower abdomen, and the Zofran, I gave it in the right ventrogluteal space. Okay, and then I'm initialing that I gave it. Okay, so now moving on to the pills. You okay with the thickened nectar?
Yeah.
Okay, wonderful. So we're gonna go ahead and start off with the antiarrhythmic medication. This is for your heart. This is for that fluttering feeling that you're having.
Mm-hmm.
This is gonna hopefully help decrease that fluttering feeling that you're having. It's gonna slow it down. So we hopefully can get a regular heart rhythm going, okay? So I'm gonna go ahead, and what I would do is I'd open this up directly into the cup, not touching the pill or anything like that. So if you want to go ahead and just take that.
Okay.
And can I go ahead and see? Perfect.
Okay.
All right, marking down that I gave that to her in my initials. Next one, this is another heart medication. This is an ACE inhibitor. What this is really important is for your blood pressure. Your blood pressure is really high and we want that low, okay? Or not low, we want it to be lower within the right range, okay? Your heart is under a lot of stress. We want to make sure that the blood pressure is under control, okay? So I'm going to go ahead and open this up.
Okay.
And then I'd make sure that you know that this is something that most likely you're going to be taking,
Okay.
even if your blood pressure is within the right range. Can I go ahead and see? Perfect. Okay. And the next medication is something else that is going to help you and help your heart not work so hard. This is warfarin. This is anticoagulant, okay? So while the other medications are helping directly with your heart, this is going to help prevent any sort of clotting factors. So I went ahead and checked. We're good to go ahead and give this today. This is really important to know that if you go to the bathroom and you see any, it looks almost black, but it's blood in your stool,
Okay.
you need to let us know. If you're brushing your teeth and your gums are bleeding, even with a soft toothbrush, really badly, you need to let us know.
Okay.
Okay, so I'm gonna open that, have you take that.
Okay.
Do you have any questions about it?
Yeah. No, I'm okay.
Okay,
It's
all right.
everything.
I know it's a
I've had
lot of
bruises
pills.
occasionally. Is that okay? Or should I
Yeah.
be watching that?
If it's something that's like extremely unusual for you, please let us know. But
Okay.
we'll go ahead and make sure we keep an eye on you. And obviously, you're a type 2 diabetic. We're going to be giving you insulin at times, and so you're going to be having injections.
Okay.
That's something that we want to make sure that we monitor because we are giving you injections. We are causing damage to the skin. We want to make sure that we're not causing any bleeding or internal bleeding that we're not aware of. So we'll be
Okay.
keeping an eye on you. But if you see
Okay.
something, never hurts to tell us.
Okay.
All right, and the last pill we have here is Colace, which is Ducosate sodium. It's 200 milligrams. And because you have some difficulty moving your right side, go ahead and open this into the container. This is going to help you just kind of have those bowel movements, okay? Just because you're going to be a little less mobile. And with that, you can have some decreased, intestinal movement. And so we want to make sure that your stool retains some moisture so it's not so hard, you're not getting constipated.
Okay. So
Okay.
should I take this now, you're saying?
Go ahead and take that
Okay.
now, please. All right, wonderful. You're doing well with swallowing.
Yeah.
Okay. All right. So I'm going to leave the applesauce here. I know the Zofran should be kicking in, but since we are addressing your high glucose, it's something that we want to go ahead and make sure that you don't drop super low. So what I'm going to do is I'm going to come back. I'm going to come back in about 15 minutes or so. We'll probably take another set of vitals because
Okay.
I want to have that recorded. We do have you hooked up to an EKG machine, and that's because we want to keep an eye on your heart movements and the rhythms. We want to get that atrial fibrillation under control. I'll go ahead and bring back like a complex carb, like dry toast and
Okay.
some peanut butter, okay? Because I know
Okay.
you refuse breakfast, and
Yeah, that sounds good.
I understand, but we want to make sure that you're still getting fed, okay?
Thank you.
All right, so I'm going to go ahead and make sure that you have your call light next to you. I've already looked at the room and made sure that there's no debris or any tripping hazards. I don't want you getting up out of your bed. If you need to get into your wheelchair, or if you need something, you need to go ahead and utilize that call light, and then I will help you, okay?
Okay.
I know it's
okay.
hard because you haven't been in this position before,
I know.
but we need to
I'll
go
be
ahead. Okay.
Okay.
All right, so I'm going to go ahead, and at this point I'm going to gather everything. I'm going to document all the medications, which I already have done in the chart, and then I'll also document the patient's response within the electronic record of how well she did and her response to the injections, etc.